yesterday we did present a report in Parliament as the Health Committee in as far as what is happening with the rollout of social health insurance. And there are two elements to this. First, there is the recipient side, patients who are receiving services. And there is the facilities that are offering services. As at this point in time, the patient side, in terms of registration in Social Health Authority, is performing very well. But there is a lot of apathy in terms of committing by making payments once patients have been assessed for their annual contribution. And the use of the means testing as the tool for measuring how much each registered member is supposed to pay is acting as a deterrent and contributing to the apathy Kenyans are having towards being subjected to the means testing. Number one, means testing became contaminated when it was used in the education sector. It had not been demystified, and now it has been introduced in the health sector. And therefore, the ordinary people are saying, I have a child who was in a university, and when we were subjected to means testing, our university, the computation placed that in a band that was way above our means of income. So there is a big disconnect, and there is total apathy. And we had better recognize that apathy and come out with ways of sorting it out. Of course, there is a question of the review of the means testing, but the review is not sufficient. The review has to be explained clearly to the ordinary people so that they own it. If they do not own it, we will be back in the same place. The second issue, in our African context, can means testing be done on a computer? And I'll give you this example. I have an elderly lady known as Mama Waziri in Doringo Muslim village. From when I was a young man, she lived in a brick house because her husband was alive then. For 25 years, she has been a widow in the same house. For 25 years, she has had a TV. But every time we distribute relief food, she is always number one in the list of the chief Ruringo for receiving relief food. But when she goes to fill means testing, unless we want Mama Waziri to lie when she's filling in the data on the nature of her house.
It's a brick house.
It's a brick house. It has electricity. She's connected to Nyawasco water, but it is well-wishers who pay for her bills.
Okay.
So that's number one. Number two.
Because of time, I want us to go a bit
just allow me to bring this one item. The facilities that are offering services are owed money, not only by NHIF, but also by SHA. Nyeri County today is owed by SHA, not NHIF. Nyeri County, level 4 and level 5 hospitals are owed 130 million. How can the county offer services with that kind of backlog? Lastly, an organization that is managing the medical scheme for police officers and teachers, an organization known as MAKL. That insurance management firm is also owing the same facilities a substantial amount of money, yet it is a private sector enterprise.
This is 4 months since the rollout of SHA.
Yes.
If it was going to work, it would have worked by now, Bwana Makalibu.
You know what happened, Fred, when we were in